County better. Today we're going to talk about one of the largest issues that faces Erie County with the greatest cost, Medicaid. And my plan to reduce the burden that is placed on the taxpayers starting on day one of the Mark Poloncarz administration as the next Erie County executive. Although Chris Collins likes to cite Medicaid as the root cause of all our problems, the fact is he has failed to even put a dent in addressing rapidly increasing Medicaid costs. Instead, he's focused on proposals that will not produce taxpayer savings and represent a serious misunderstanding of the cost posed by the program. Chris Collins' short-sighted call to take away eyeglasses, hearing aids, and even dentures from needy seniors and families across Erie County, rather than embracing proven cost-cutting measures that other counties have put in place already, shows that he does not understand why Medicaid is such an expensive program, nor does he understand the vast array of Erie County residents that actually receive Medicaid benefits. As comptroller, I have analyzed Medicaid and made recommendations on how we can reduce the costs associated with this program. But I don't have the power to implement those recommendations at this point. As county executive, I will have the power, and I will reduce the cost of Medicaid by implementing proven programs and initiatives being used elsewhere in New York State, programs which will save Erie County taxpayers millions of dollars annually. As I travel across Erie County and talk with the residents about the issues that are important to them, I have heard the same sentiments concerning Medicaid that we hear regarding Medicare and Social Security. These are the same sentiments that my friends and colleagues in the Erie County Legislature, Tom Mazer, Betty Jean Grant, and Tom Logren. People are upset. They're upset about the growing costs of the program, but they want the programs to continue. They want to ensure that we have Medicare, we have Social Security, and if needed for our friends and family members, that we have Medicaid. But they want to determine and want to ensure that the costs associated with those programs are controlled through greater efficiencies, and we root out waste, fraud, and abuse in the program. While Chris Collins continues to focus on meager aspects of Medicaid that will produce little cost savings and only hurt the people who need the services, I have been studying this issue for years and made recommendations based on proven cost savings all across New York State that will lower the costs for the taxpayers of Erie County. Recommendations that Chris Collins has ignored time and time again. In June of 2009, my office conducted a review of Erie County's Medicaid anti-fraud processes, provided that review to the Erie County Legislature, which did an exhaustive review of itself, and noted that since late 2005, Erie County administrations, including the Collins administration, have been pointing to the potential to recover millions of dollars from Medicaid anti-fraud revenue recovery efforts, but they've done little to actually enforce that. While places like Monroe County, in Rochester, and New York City are being presented with $500,000 checks by the New York State Office of Medicaid Inspector General and the New York State Department of Health for their assistance in recovering millions of dollars of overpayment and fraudulent Medicaid payments, Erie County is not receiving any checks and is not doing anything. At the same time that Chemung County opened its Priority Community Health Care Center and saved its taxpayers over $2 million in the first year alone, Chris Collins instead closed 2 public health clinics in the city of Buffalo, forcing Medicaid recipients to seek primary care at emergency rooms. Emergency rooms on average cost 5 times as expensive as they did at the clinic. In 2009, the last year we had accurate data because that was the last full year the clinics were in operation, Erie County clinics in downtown Buffalo saw over 27,000 visits. At a combined cost of the 2 clinics of $2.3 million, or an average of $88 a visit. An average cost for an emergency room visit in Buffalo is $500. And that's where these individuals are going now for their primary care. When their kids get sick, when they have issues that need to be resolved. Instead of going to a hospital, instead of going to the clinic, they're going to an emergency room. And that's wrong, because it's costing the taxpayers of Erie County 5 times as much to handle the costs associated with those individuals. Ironically, the county executive instituted these cuts among the clinics. At the same time, his health commissioner, Anthony Billetier, issued a comprehensive report that addressed the issues with regards to the community's health assessment. And as part of that report, the commissioner noted Erie County needed more clinical programs to address the number of issues that were growing, especially in minority and socially disadvantaged communities right in the city of Buffalo. But the county executive didn't listen to the report. Instead, he closed clinics that were making money for the people of Erie County. Even now, my office is working to identify fraud committed by the county's Medicaid vendors, and the Collins administration has been doing nothing but putting up roadblocks, trying to stop us from doing this investigation. Over the past 4 years, Collins has a record of failed opportunities, and I believe it is time for someone with a proven record as the taxpayer's watchdog to combat the high cost of Medicaid by finally addressing the root problems of the program, going after the waste, fraud, and abuse that inevitably exists, while reducing the costs associated with delivery of Medicaid services to individuals. That is why today I am pleased to release a report entitled Managing Medicaid, Reducing the Burden on Erie County's Taxpayers. This report analyzes exactly what the services are that Medicaid provides, what Erie County has done, or what I should say it hasn't done, to reduce the cost of Medicaid, and what other forward-thinking counties across New York State are doing to reduce the Medicaid burden of their taxpayers. Furthermore, this report describes the plan that I will implement as county executive to reduce the cost of Medicaid. It is a two-part plan that will reduce the cost of providing basic health care to Medicaid recipients and work to expose and recover Medicaid fraud. And the major parts of this plan, as I said, are: first, I will use the current Erie County Department of Social Service resources to create a new Erie County Medicaid Inspector General's Division to work with our partners in government and the private sector to expose provider fraud and assist in the recovery of improper payments, leading to millions of dollars of savings for Erie County tax dollars. If there's one thing I've learned as the Erie County's taxpayer watchdog as controller, people will try to bilk the system, but if they know that somebody's out there watching and going after them, they will stop. That's one thing we've learned as being Erie County's auditor. Unlike our other counties in New York State, Erie County is not working with our partners in government and the private sector to go after large-scale provider fraud. Just like I transformed the Erie County Division of Audit into an Inspector General like Taxpayers Watchdog, I will re-engineer the Erie County Department of Social Services resources into a County Medicaid Inspector General like Watchdog to root out provider fraud and assist the New York State Office of Medicaid Inspector General and the Attorney General to recover overpayments. That will save millions in the long run. And second, I will work towards the creation of a new clinic, the Erie Community Healthcare Office, which will serve as a point of entry for Medicaid patients. Such a clinic could be placed in one of the former clinics that were closed by the county executive, thereby saving taxpayers money. I remind you, those clinics actually made money for the people of Erie County, include covering the legacy costs associated with the operation of those clinics. Instead of Medicaid recipients going to a hospital emergency room for basic health care, as I've noted, which is 5 times the cost on average of a clinical visit, recipients will go to the Erie Community Healthcare Office. Instead of Medicaid patients ignoring basic checkups and preventative care, the county will monitor the recipient's health care for better disease management, thereby leading to decreased costs. In the end, such a center will reduce program misuse, fraud, and overuse while providing quality care, and as was the case with the clinics that were previously closed, will make money for the people of Erie County. Moreover, as our friends in Chemung County had seen, it will save millions of tax dollars in the first year alone by controlling costs that are presently beyond the control of Erie County government. Chemung County saved $2 million in the first year of operation, and they only had 3,000 clinical visits. Erie County, in the last year of the operation of the 2 major clinics in Buffalo, had 27,000 clinical visits that ran the gamut from prenatal care to taking care of our seniors. And a vast majority of those clinical visits were related to individuals who were on Medicaid. That is why this makes sense. Not only will it make money through the clinics, it will save a lot more money through the reduction in costs of Medicaid. The county executive complains about soaring Medicaid costs, and yet he has done nothing. I have a plan based on successful techniques employed in other counties in New York State that target the costs that we can control. And ultimately, once implemented, it will reduce the burden on the taxpayers of Erie County. This is a plan that's a good plan, and that I look forward to implementing when I become county executive on January 1st. Thank you for your time, and I'd be glad to answer any questions you may have at this point.